Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXVX. Paul Thomas and Bill Kearney in the studio for another round of Health Talk, and welcome to the program. And Bill, I think we got our phone line fixed.
Did we?
Yeah, let's take a listen. Sounds good.
Oh, yeah. So it's 263-5422.
5252.
Oh,
5252. We were using the 5254.
Oh, that's right.
But we're back to the 5252.
I mean, I had that memorized for 30 years.
I know, and then I threw a wrench in it,
yeah.
and here we are. But yes, we got it fixed.
Well, good.
Yeah.
Well, it's a great day today, and I think we'll probably have some winter weather coming in,
Yeah.
which is kind of nice. And
Sure.
would like to start out by thanking the community and the people of STARS for giving me the
Congratulations.
Lifetime Achievement
Yes.
Award. I thought you're usually deceased by the time you get that, but I was still alive. It was a wonderful presentation, and they gave me a standing ovation, and it was quite an emotional evening. So I appreciate what the community has done.
And well deserved.
Well, thank you
Yes, very
so
well
much.
deserved. Yes.
I was not expecting it. I was sitting there thinking one of my patients actually would get that, and she had. It's a good thing she didn't, because she had a trauma in her life that day, and it was. But it was so rewarding to get that award, and it's sitting in the pharmacy, and was very surprised when I received a standing ovation, and it was just a great evening. So thank you to all our listeners out there, and thank you to the Chamber of Commerce for putting this on so many years. We have sponsored the Woman of the Year for 20 years since this whole thing started. And actually a friend of ours, Janine Bogner, received that, and I was just happy to see everybody that got the awards. It was just a really special evening. So what we're going to be talking about your health and things we can do to try to make things better. We talked a little bit the last couple of weeks about an over-the-counter drug that has opiate-like qualities that can be fatal if taken, and they've just raised the death count from Kratom, which is a natural opioid, to 44 fatalities from the herb. It's a rising death toll with the use of this drug, and it's overseen, the FDA is overseeing the recall and destruction of a large volume of potentially deadly dietary supplements that contain this herb. It doesn't require a prescription. It's over the counter. There are retailers that are selling it, and it's particularly effective when it comes to relieving pain, and it didn't require a prescription. But this action involves supplements made by Divinity Products, distribution of Grain Valley, Missouri, and distributed under brand names including Enhance Your Life and Divinity. The Food and Drug Administration said in a statement Wednesday, in cooperation with the company, they agreed to stop selling products containing Kratom. Scientific data that they've evaluated about Kratom provides conclusive evidence that those compounds containing Kratom are opioids and are expected to have similar addictive effects, as well as risk of abuse, overdose, and in some cases death. The FDA has also been assessing peer-reviewed research and a growing number of events associated with the use of Kratom. So they're facing opioid lawsuits. It's Big Pharma versus State Attorney General, and I know how that comes out most of the time. The State Attorney General usually wins. So the alerts came out in 2012 and 14, and I didn't even know anything about this until December of 2017. But the deaths occurred from April 2011 through December of last year. A recent death reported was where the person died of opioid use. The only drug in the system was Kratom. So with our country right in the middle of an opioid epidemic, the FDA is concerned that people are viewing it as a natural alternative to prescription drugs when there's little or no difference between them. In fact, they're even used them to get off opioids when in fact it is opiates. So the CDC, the Center for Disease Control, and the FDA advised against consuming kratom. In November, the FDA reported the calls to the U.S. Poison Control Center regarding kratom rose 10 times from 2010 to 15, with hundreds of calls coming each year. We're going to talk a little bit later about the effects of some of these things in use today, and how some of the drugs that we've used to get off of opiates have tailored themselves to being a lot more expensive, and they're not any more effective. And we'll talk about those. The new thing that's taking the limelight a lot now is liver disease, and it's called fatty liver. Your liver is the ultimate multitasker. It's the largest solid organ in your body. It's about the size of a football, weighs 2 to 3 pounds, and sits on the right side of your abdomen, just under the rib cage. This organ typically mirrors your body shape, long and lean, or squat and square. You can determine by looking at me which liver I have. It's not the lean or long and square. Specialized cells work to maintain your health. Some of your liver functions include metabolism, which means breaking down the food and in your gastrointestinal tract, and it turns nutrients, carbohydrates, fats, all those things to processes through your liver, and it helps regulate blood sugar levels, and lots of times pulling excess glucose from your blood and returning it to when you'll need it later. That happens on a regular basis, but if you consume too much sugar, it will transfer into your blood and cause you to be have hyperglycemia, which means there's too much sugar in your blood. It takes those fats into energy in forms that your cells can use. It produces and manages cholesterol. It forms proteins, including those that play key roles in cleaning the blood and forming clots. It metabolizes many hormones, including estrogen and cortisone, and vitamins and minerals, including iron. It actually acts as a big filter, cleaning those bad substances out of your blood by preventing damage. In addition, it has specialized cells, which, among other things, ingest and destroy invading bacteria. So bile production, which if you've ever vomited until you have nothing left in your stomach, you'll vomit bile. Approximately 2 cups of bile are produced each day by your liver. That breaks down fats for further digestion, much like, if you had a dish detergent that was dissolving grease. It does the same kind of thing. Most of it is stored in your gallbladder, and from there it's excreted into your small intestine during meals. It's also a major vehicle to get waste out of your body. But liver damage has become more and more of an issue. The range of diseases and factors can trigger all kinds of symptoms of liver damage. You can have hepatitis, which is the term for liver inflammation, which is a sign that your liver is trying to actually fight an infection or heal an injury, and it may go away with treatment or removing the substance that's causing the harm. However, medications such as alcohol will damage the liver more and more. Fibrosis, which is untreated inflammation, leads to scarring. Each time your liver is injured, it tries to repair itself, and it can. It's one of the organs that can repair itself. In the process, scar tissue forms. Eventually, more and more scar tissue forms. And if you have that going on in your body from either liver disease or from various fractures and from various surgeries, nothing will heal as well as your liver. Cirrhosis, you've heard of a lot of alcoholics dying of cirrhosis. It's when that scar tissue builds up to a degree in which your liver can't heal itself. And it can take many years for the liver damage to progress to cirrhosis. As that worsens, the liver loses its ability to perform its critical functions, and you've heard about waste and metabolism and breaking up things to form proteins and getting rid of carbohydrates. That can be life-threatening. With treatment of the underlying cause of liver disease, even that advanced stage of liver damage can be potentially reversible, although it could take a lot of years. And unfortunately, by the time we get into a physician where we found out that we have cirrhosis, and you know, you have a feeling, I've never had it, but your body feels different when all those wastes and carbohydrates and fats are building up in and eventually you will have liver failure or liver cancer. People with cirrhosis are really at a high risk for developing cancer that starts primarily in the liver, with 30,000 new cases every year just in the United States. The rate of liver cancer has more than tripled since 1980 and is on the rise. It often has a very poor prognosis. Less than 20% of the people diagnosed remain alive after 5 years. That is kind of startling to me. I didn't realize it was that fatal. I have known people that really have survived from having liver cancer, but not very many. And then it goes into liver failure when your liver is losing or has lost all of its function. That may happen gradually or may happen over a long period of time. May come on suddenly, requiring immediate medical attention. The acute damage or instant damage is usually due to medication overdose, chemical toxicity, a viral infection, or sepsis. And we just had a lady that we talked about a couple of weeks ago that had the flu and ended up in 3 days dying of sepsis. So a lot of different diseases can control the liver damage. Chronic alcohol abuse, that's the most common cause actually in the United States. Fatty liver, which is the new thing, that everything is building up in excess of fat in the liver. When people drink to excess, there may be no symptoms, but sometimes the liver becomes enlarged. It may be reversible at a stage when alcohol consumption stops. And it's not always related to alcohol consumption, but and then alcoholic hepatitis, many people could continue drinking alcohol and go on to develop liver inflammation. At this intermediate stage, it may still be possible to reverse the damage by abstaining from alcohol. And then alcoholic cirrhosis, which we talked about, develops 10 to 20% of heavy drinkers, often after prolonged and excessive alcohol use. By then, you can't reverse the damage. If you have liver disease associated with alcohol use, it's critical to stop drinking. Abstinence may stop the progression of the disease and reduce your risk of complication, but it's not positive that it will. And then you have chronic viral hepatitis. Although that's the general term for liver inflammation, it's also the name for a specific group of viral infections that really can affect the liver. And the most common types are hepatitis A and B and C. While A doesn't have long-term liver damage, it can cause acute liver failure, especially in older adults or people who have chronic liver disease. Hepatitis B and C can cause chronic liver damage as well as liver failure. Liver failure due to hepatitis C is the most common reason for having a liver transplant. People with chronic hepatitis B infections are at an increased risk of developing liver cancer, even though they don't have cirrhosis. We have vaccinations for hepatitis A and B. We just had some people going to South Africa in a few weeks, and they received both hepatitis A and B. And those are a multiple shot that you have to get 2 to 3 doses of. But if you're going immediately with the one shot, you have protection while you're there, and then it's a follow-up afterwards. Also, fats accumulating in the liver which is called non-alcoholic liver disease, unrelated to alcohol consumption or other distinct causes. It's caused a disease that's increasingly common around the world, especially in the West. In the United States, it's the most common form of chronic liver disease. Affects estimated 30 to 40% of the population. So a cluster of abnormalities, including increased abdominal fat, insulin resistance, high blood pressure, and high triglycerides. You know, I've had high liver LFTs, liver function tests, for most all of my life. I inherited that. And some time ago, after, you know, I've been here about 40 years, after I'd been here about 5 to 10 years, one of my patients asked me about a drug that's called milk thistle. It's a silymarin, which is a compound extracted from the seed, has an antioxidant and anti-inflammatory properties, and may encourage liver cell growth. I have, after going through a period of complete abstinence from alcohol, and it didn't change, not that I've been a hearty drinker of alcohol, but it wasn't a big issue for me to not have anything to drink at all. And 6 months later, I had a test, and the LFTs didn't change. A number of studies have gone by that because you can buy milk thistle over the counter. I have taken it for probably 25 years. I still have an elevated liver function test, but it's not to the danger level. It's just at the beginning stage. Never changes. Once in a while it goes down, but it's still just above the lowest range. In the tests that the Mayo Clinic have done with liver health benefits from milk thistle or silymarin are mixed, and most studies have been poor or poor quality, and more evidence is needed before those herbal products can be recommended as a treatment for liver problems. If you want to try it or other alternative therapies, talk with your doctor first. Not all these herbal supplements are safe, and many can cause liver damage or failure. There are a lot of natural herbal products on the market that could cause you to have a fatty liver and get liver disease. So be aware of when you have a test, when you're taking, lots of times it's medication. One of the things about PPIs were people that were on proton pump inhibitors reduced the microbial diversity in the gastrointestinal tract. And that means it got rid of some of the things that were protecting the gut and made liver disease more able to take place, and probably did, more probable. Those connections may open up the new possibility of new treatment options. Maybe an individualized approach means targeting the microbes that are the ones that we don't want to get rid of and leave those alone. A new released study found that any heart protective health benefits of alcohol consumption do not extend to people with liver disease. That was by the Mayo Clinic, and they shed light on the relationship between that and cardiovascular health. Cardiovascular disease, which is a stroke or a heart attack, is generally less prevalent in women than in men. However, the population of people with fatty liver disease, where women were more likely to experience the heart-related problems than men at an earlier age. So a lot more research needs to be done. It's kind of a boring thing to listen to if it doesn't affect you, but taking care of your liver is very important. You can't really influence every factor, such as your genetics that we just talked about with me. You may also have a control over a wide range of choices that can preserve your liver, and you know that I'm going to tell you exercise and diet. If you've already had liver disease, these things may prevent further damage and may reverse the damage, and maintaining a healthy lifestyle regular exercise, limit or avoid alcohol consumption, try to do everything you can to save that organ from being a cause of so many different things. It's almost getting to be like cancer. There can be so many issues that can come up that may be related to the kind of things that are causing you to have liver disease, as they do in cancer, and we're learning more and more about these. We just went to alcohol before, and that isn't always the thing, but it's a moderating factor that could cause some problems as we go down the road of trying to age healthy and be the best that we can be. And sometimes those things conflict with each other, and we have to know which one's doing which. We were going to talk last week, and we never got to it, about the different risks and benefits of taking aspirin every day. And many of us occasionally take a dose of aspirin to ease the pain of a miserable headache and cramps or body ache, and it actually is a blessing when we desperately need some pain relief to go through the workday. There is such a thing as too much of a good thing, and that's why experts say you need to consult with your doctor when you become taking aspirin every day. As I've said many times on this radio program, that if, in fact, aspirin were to come out today, it would require a prescription. It is a great anti-inflammatory drug, probably the best non-steroidal anti-inflammatory drug there is. It's the oldest, most widely used drug in the world. It's taken for pain relief for over 2,000 years. Its active ingredient is salicin in the leaves and bark of the willow tree. I mean, this is really going to date me, but back when I first got into pharmacy, back in the small town of Osceola, Iowa, we had a back room where we took natural substances, and willow tree bark was one of those, and you sold it as a substance to put on an animal's wound, and it helped heal. In 1897, the Bayer Company in Germany developed a synthetic version that called it salicylic acid, or ASA, and named it aspirin. The regular adult dosage is 650 milligrams, taken every 4 hours when needed to treat pain, inflammation, and fever caused by a variety of ailments. And low-dose aspirin refers to dosages between 81 milligrams and 325 milligrams taken every day to prevent heart attacks, strokes, and colon cancer. Most heart attacks and strokes happen when a blood clot forms, and then the clot blocks blood flow in an artery, and under normal circumstances the body develops a blood clot to stop the loss of blood after an injury. Well, when a blood vessel is damaged and sticky cells called platelets begin to clump together while proteins in the blood form strands of fibrin, that fibrin creates a net-like structure that holds the forming blood clot together, and they can form in damaged vessels of the heart or the brain, or they can block blood to the tissue, causing a heart attack or a stroke. Aspirin stops clots from forming by preventing the platelets from clumping together. So if you've ever had a heart attack or a stroke and your doctor may prescribe low-dose aspirin to prevent a second event, low-dose aspirin has been shown to reduce the risk of first heart attack, but has not been definitively proved to reduce the risk of a stroke. Talk to your doctor and see. There are times when I know it shouldn't be pharmacist heal thyself, but times when I'm not sure that the pain or inflammation that's running through my chest is from a digestive symptom or it's from possible blockage, and so I will chew a couple of children's aspirin if I feel that coming on. Not very often, and supposedly it goes away. the best way to tell if that's your digestive system or your heart problem is take some liquid Maalox or liquid Mylanta, and if that makes it go away as well, it isn't your heart. But there are times when 911 or people that can't get there will tell you to chew a couple of aspirin if you think you're having a heart attack. You know, aspirin is a non-steroidal anti-inflammatory, which means that it reduces the inflammation, although it's not a steroid like cortisone or prednisone. And when an injury occurs, the immune system is activated and compounds called prostaglandins form in the area surrounding the injury, and that increases blood flow to the injury, leading to the redness, the heat, and the swelling. Aspirin prevents those from forming, reducing inflammation. It is aspirin's anti-inflammatory action that also makes it useful in the prevention of colon cancer, a serious condition that is believed to result from an inflammatory process. It is also found regular aspirin to be used associated with lower rates of breast cancer, prostate, lung, and ovarian cancer. But what you have to understand is this isn't okay for everybody. Even in low doses, it can have significant side effects. The most common ones occurring in up to 10% of the people who take aspirin are increased tendency to bleed and stomach upset. Remember, we were talking about PPIs being a cause of maybe liver failure, but PPIs are one of the drugs that actually reduce the irritants, the acid ingredients that are in your intestinal tract, and can cause sometimes those to disappear. Although over-the-counter aspirin, low-dose aspirin, in fact, is OTC and drug safe for most people, the FDA recommends that certain individuals not take any aspirin in any dose. Of course, those with an allergy to aspirin or salicylates, those with a bleeding disorder, many times those that are already on a non-steroidal anti-inflammatory, which also makes the blood thinner, those with hemophilia or vitamin K deficiency, and people with uncontrolled high blood pressure or severe liver or kidney disease. Before taking any over-the-counter on a regular basis, even low-dose aspirin, be sure to talk with your healthcare provider first to find out if it's right for you. Always ask about your pharmacist giving you information on over-the-counter medications for aspirin interactions or any incompatibilities, even with fish oil and vitamin D, can interact with aspirin. So it's necessary in most cases for individuals to take it for an event, but there isn't a ton of proof to show that everybody should take aspirin for a cardiovascular event. Even if you have some of those symptoms that we talked about, then certainly it's not a disadvantage to take a baby aspirin as much. It also can be recommended even earlier for people who already have heart disease or have had a stroke, but it's rarely recommended for healthy individuals under 40. And like every other medication, there's risks and benefits to aspirin every day. Both should be taken in account when making a decision about a daily regimen. Although aspirin is safe for daily use, it only should be taken if your doctor determines that you're, remember the risk versus benefit thing? If the benefit outweighs the risk of bleeding, then it's worth taking. If it doesn't, it's not worth taking. It isn't a harmless drug because it thins the blood. And aspirin can increase the risk for bleeding, most commonly in the stomach, occasionally in the brain, and that becomes a hemorrhagic stroke. Any people who already take medications that increase the bleeding, such as non-steroidal anti-inflammatories or the anti-clotting drugs, should be very careful about taking aspirin at the same time. If you don't have cardiovascular disease, it's probably less obvious and must include a careful look at your doctors asking about cardiac risk and risk factors of bleeding, and then see whether or not you're a candidate to take this drug on a daily basis or not. You know, it used to be we would tell you you would get ulcers, and you still can, but we're finding 95% of the ulcers now are caused by a bacteria rather than by a gastric acid that's produced from too much of an acidic gastrointestinal system. We're going to take a break, and when we come back, we're going to talk about the CDC, which the Center for Disease Control is urging everyone 50 and older to get this new vaccine. As our aging population continues to increase, we as healthcare providers and also family members have an added responsibility to take care of them. Hi, my name is Bill Kearney, pharmacist and owner of Northlake Medical Pharmacies in Lakeport. Our senior population brings us new issues as they continue to age. Our bodies change as we age, and they need a pharmacy that cares about their care. I had a lady come into our pharmacy the other day and ask if we still were a locally owned pharmacy. She was tired of the lack of compassion at the big chain pharmacy she was dealing with. When you become our customer, you will see our goal is to get to know our customer. We believe personalized attention combined with competitive prices are what people are looking for. So when you come into our pharmacies and our employees call you by name, don't be surprised, but feel how important you are to us. That's why our family-owned pharmacy has continued to exist this 38 years in Lakeport. Northlake Medical Pharmacies with 2 locations to serve you, on Hill Road East across from Sutter Lakeside Hospital and outside the Bruno Shops Mart in Lakeport.
A fundraiser for Clear Lake Adult Day Center and a 50-50 raffle will be held on Wednesday, February 28th from 5:30 to 7:30 p.m. at DJ's Pizza in Lower Lake. All-you-can-eat pizza for $8 per person. The Clear Lake Adult Day Center provides a 6-hour break for those caregivers, providing care for those with dementia. For more information, call 994-5141.
America had just gone to war when Felipe Adams volunteered.
I knew what I was signing up for. I knew the consequences. I took a bullet to the side and it left me paralyzed.
For Armando de la Rosa, the Navy was a chance to serve and see the world.
I got medically discharged in 2001.
Armando and Felipe were brought together by a unique organization that serves our paralyzed veterans.
If there was no PVA, it would be a lot of confusion. Our training is to better the veteran. We help out with the auto grant, the special housing adaptation grant, education, prosthetics. Our main focus is spinal cord injury and disease, but we see anybody.
First thing he had asked me before you even asked my name was I being taken care of as a veteran? And I thought that was pretty good.
Changing lives, building futures. That's Paralyzed Veterans of America. To learn more, visit pva.org.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you.
The Lake County Chamber of Commerce would like to recognize their Member of the Month, Tompkins Tax Consultants. John and Diane Tompkins have been serving Lake County since 1974 and have been a member of the Lake County Chamber of Commerce for 24 years. They provide services to many small businesses and individuals in Lake and Mendocino County. Their main office is located in Lucerne off Highway 20, and they also have a second satellite location in Lakeport at 576 Lakeport Boulevard. For more information, reach them at 274-1843.
Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
All right, Bill, we're back, and it looks like snow?
Yeah, I was,
Snow in the forecast.
I was looking for a snake downstairs that was in my office.
Oh, really?
I had these big snow boots that I gotten when I used to go to the Derby Hat up in Oregon in the wintertime, and I turned them over and there wasn't any snake in there. I 2 little ones that were down in the basement, and so I thought, well, I'll just throw these back up on the top shelf, and then I saw the weather forecast.
Oh, yeah.
Said I don't think that I'd need big boots for this kind of snow that we're getting, but
Yeah.
I haven't been in the snow for I think since I went to Yellowstone a few years back.
Well, they're predicting 1 to 2 inches of snow at lake level And if you're up on Cobb, you could get 6 to 12 inches up in the
Wow.
higher elevations. And so, yeah, that's, pretty significant. And then up in Lake Pillsbury, up to 3 feet of snow. So this is probably going to be a pretty significant storm.
Well, I hope it is, and I
Yeah.
hope it's. And I saw the weather for next week, and there's rain forecast for next week too. So maybe we'll get a little
Yeah.
start, a little impetus to
Well,
winter now.
Some
so-
excitement.
Yeah.
Yeah.
Well, I'm excited about this. The Center for Disease Control urges everyone 50 and older to get a new vaccine. And it wasn't hard for me to figure out what this was, because there's only one vaccine I know that just came out that says that you can get it at age 50 instead of age 60, and that's the new shingles vaccine. This is the newest vaccine, the latest defense against shingles, which is more common among older adults. And the Zostavax shot we had before said that it should be given to people 60 and older. This new vaccine says if you're 50 or older. So the difference is, well, it isn't really a difference because Medicare doesn't pay for it anyway. Medicare doesn't pay for either one of these, but the shingles shot that's out now is a 2-shot shingles vaccine for adults 50 and older. And the CD still recommends Zostavax as an effective treatment for shingles, and I'm still giving Zostavax. But now this is better for older people. This recommendation was supported with the CDC's Advisory Committee on Immunization Practices, 14-1. That vote was made in October, but the details on which the committee based that decision were just recently released. If you've never had shingles before, it's a blistering rash that typically clears up within a few weeks. And unfortunately, it can lead to a lot of complications. The most common complication is post-herpetic neuralgia, and that is a pain that is excruciating and can last for months or years after the rash is gone. And if you've listened through the years, you'll remember that my sister had this for 6 years, and she also had a stroke because of it, and she has residual effects from the stroke. So shingles is known as herpes zoster, and it's caused by varicella zoster virus, which also causes chickenpox. So what happens when you recover from the chickenpox that you had as a kid? The virus stays inactive or dormant in your body, and they aren't sure why the virus can't reactivate until years later, causing shingles. But anyone who's recovered from chickenpox can get shingles. So although the risk of developing shingles increases with age, in the United States, close to 1 in 3 people will develop it at some point. The interesting part is, what is the trigger with shingles? And it's different for everybody. Sometimes it's stress, sometimes it's medication, sometimes it's sunlight, sometimes it's a kind of food that you eat. Nobody knows what the trigger is going to be for you. Part of the big deal about Shingrix, which is manufactured by GlaxoSmithKline, is how effective it is. The clinical trials found out that the vaccine was more than 90% effective in preventing the shingles in folks age 50 and older. Zostavax, by contrast, is anywhere from 38 to 70% effective. And AAR reports that insurance companies would be more likely to cover Shingrix in light of the CDC's official recommendation. But here's the kicker. GlaxoSmithKline, which is the company that manufactures, notes that the broad coverage is expected to kick in starting in April. Now, I heard the date of April 18th, but I don't know that to be a fact. And my insurance, which is a Medicare D insurance, I got my second shot. I got my first shot on December 12th, and I got the second shot on February 12th. The second shot comes 2 to 6 months after your first shot, and my insurance company paid 50% of that shot just a couple of weeks ago. So that's still $75 a shot, but for a total of $150, I could immunize myself instead of $300. Now, if you've heard me talk about Shingrix before, there is a risk of having more side effects than you had with Zostavax. And I, for one, have had the shot twice now, the first shot and the second shot. My arm was particularly sore the second day and halfway through the third day. And then 2 months later with the other shot, it was the same thing. Now, they warn you in the literature that it may be an excessive side effect, and that may be the difference of you getting this shot or getting Zostavax. Well, it didn't happen with me. I gave another individual her first shot a week or 2 weeks ago, and she developed a sore arm that lasted for 5 or 6 days, and then it went away. No blisters, no huge thing, just a sore arm. So it certainly would be worth getting that shot when and if it goes under your insurance. And in fact, if you have the money, it's worth getting it anyway because it is extremely excruciating. And if you were like my sister, who had such a large amount of time go by and then develop a stroke in between, you certainly wouldn't want to go through that if you had an option not to. So it's called Shingrix. Your doctor knows about it. We have it at the pharmacy. We're still advising people, if they can wait and try to get it at a different time, and maybe it will be less expensive. But right now, it's going to cost you around $300 to get both shots. You know, there isn't a news show that goes by that we don't talk about big pharma and healthcare. And Rite Aid became Albertsons bought the rest of Rite Aid the other day, and became more attractive under the Albertsons name than it was before when it comes to prescription benefits. So whether Rite Aid keeps its pharmacy benefit manager, and you remember those pharmacy benefit managers are those people that increase the price so they get more instead of you, and they can keep the same insurance company. Their PBM value could take off under the umbrella of the large grocery chains. Now, Albertsons owns several different companies in its chain, and the PBM is a national player, which is going to be called Envision RX. PBMs are the middleman between the drug makers and the patients, and they are going to be giving bigger discounts for their patients. In the past 2 years, the Wall Street analysts and other observers of Rite Aid had worried that Envision RX would lose employee clients amid the sale to Walgreens. Now, Walgreens bought part of them, but they didn't buy all their stores. They have the potential to get even bigger with additional pharmacies and prescriptions processed at customers of Albertsons stores. And those stores are Albertsons, Safeway, Vons, Jewel Osco, which is in the Midwest and the East Coast, Acme, Tom Thumb, Randall's, United Supermarkets, Pavilions, Star Market, Hagen, and Cars. Remember, I said Albertsons grocery store brands include Safeway. Most people don't know that, but that did happen. The acquisition also prevents the loss of a giant employer client to rival PBM stores that Envision RX competes with. The big four, when it comes to the PBMs, are Express Scripts, as well as Caremark, owned by CVS Health, that's your neighborhood drugstore in the shopping center, OptumRx, and United Healthcare. So those are the people that you need to be angry with about the prices of your prescriptions. If you remember, last week we talked about a CVS Caremark in Arkansas because the pharmacists in Arkansas had gone to the state legislature and showed on one individual prescription, CVS got $486 for that prescription, and the independent pharmacy in Arkansas got $20-some. Now, I may be off that a little bit, but the ratio is right. The lawmakers could not believe that, and it's happening all over the country. And the CEO of CVS says, that's fair. You know, that's really fair. That we should get $500 and they should get $25. And if you wonder why independents struggle, that's the reason. We have no control over that. They eventually will, as we talked about before, there will not be any independents left unless we do our part to get bigger rebates and bring this in front of the legislature like the state of Arkansas did. You know, I have a board member that's a very close to me on my independent pharmacy board that was there and is one of the leaders of that group to try and end this thing. At least give them, the community pharmacists, transparency. If they're going to lose money and CVS is going to make that much money, then we'll get out of the program. You can't afford to, I don't know how many times people have called me about the cost of a prescription on their health care plan and wondered why we wouldn't fill it. Well, we're mandated to fill some of these prescriptions on some of these health care plans, even if we lose money. And eventually we'll be out of that medication and we can't fill it anyway. So there isn't any way that I'm going to stay in business by losing money on every prescription I fill. And I would ask you, if you're a retailer and you're out selling candles or you're out selling jackets out on the sidewalk and they say $20 on them and they cost you $15, are you going to sell them for $10 and lose $5 on every one you sell? And you sold 1,000 coats and you lost X amount of dollars because you did. The more you sell, the more you lose. So the big chains already have our business. They try to get more of it, because if you're a good operator and retailer, you will make things work. You will find ways to make things work. I look across the street in the studio. Banger, what's it called?
Oh, the Fresh and Bangin' going in?
Fresh and Bangin'. These guys started in Lucerne.
Mm-hmm.
Hardly anybody makes it in Lucerne. There's a pharmacy right next door to them that's done a very good job of staying in business. And these individuals, and they're coming to Lakeport. They opened 2 restaurants here. And it's only because they found a niche. They either found a niche in the kind of food they prepare or how they prepare it or being nice to their customers, and maybe a combination of all of those things. But those are the things, as an independent business person, the community needs to get behind and support. We certainly have that. We certainly have people that have abandoned us because the fact that the PBMs force us to pay a larger amount to fill that prescription than they do our chain neighbors. Is that fair? No. But they lobby all the time in Washington, D.C., and they get those kind of decisions made for them. And whether or not the people on Big Pharma end up going to spend a winter in the Bahamas or wherever it is, they can afford to do so. They are some of the highest paid executives in the healthcare field, in not just the healthcare field, in the entire field. And they don't apologize for the fact that they earn that much money, and they get that much money when they actually retire from a business. So, you know, you think they're running out of ways to do this, but they really aren't. They find new ways to generate sales and volume, and to help people out that that will help them out at the same time. So all we can do in situations like that is try to combat that by doing something that makes our customers more loyal to us instead of more loyal to them. There is, you know, we talked about aspirin and anticoagulants, and you may see some new anticoagulants that are on the market after they get discharged from the hospital. And these aren't people on cardiac type anticoagulants. These are people who've had thromboembolisms and venous thromboembolism, and hospitalized adults with multiple risk factors such as older age and even some heart failure. They usually get subcutaneous oxyperon, which is an injectable that you take home. It comes in several different strengths, and you take it home and you inject it under the skin for an extended period, sometimes 10 days after you get out of the hospital, sometimes worse. This new drug that's coming out is Bavadica, or Bavadixa, and it is maybe a 6-week total that you take it. The idea is to prevent the venous thromboembolism after the first month or so after hospitalization, so they can become they may be less mobile than they normally would be when they take it. By continuing this after discharge only prevents a small number of those from developing and increase the risk of clinically important bleeding, which may require stopping the med. Plus, it only costs a mere $630 for 6 weeks. If the physician says continue it for more than 6 weeks, you need to question it. It's normally just 6 weeks total, or used in patients taking dual antiplatelet therapy with clopidogrel plus aspirin, which is Plavix. You don't normally recommend it after hip or knee surgery or a long-term prevention of the thromboembolism. So there's getting to be so many anti-clotting drugs now, and they're all expensive, and it's really hard to get them approved. And if they don't go under a special RX program, it's almost impossible to get them approved. So, you know, we were talking about Shingrix, and people refer to getting Shingrix now as a booster to Zostavax. But there are other conditions that are starting to come about in the society out there that now the Center for Disease Control will start raising questions on whether to give a booster dose of aspirin, which is, I mean, not of aspirin, of mumps vaccine. And it's the drug that's called MMR. It's measles, mumps, and rubella. Almost 6,000 people in the United States had mumps last year. We were down to almost 0. And that may be putting them at risk for hearing loss, meningitis, encephalitis. The risk seems larger in people living in close-knit settings, such as a college setting, and that's where a lot of it was coming from. Some of it came from the National Hockey League. The hockey players were getting it, and almost the entire team. Their child immunity seems to be waning as they get older, and some kids just aren't getting immunized at all. So they recommend a booster dose of MMR, and if there's an outbreak, if routine boosters will it's too soon to see if the boosters will limit the outbreaks. I wouldn't go do a booster shot now until your health department identifies the target groups. It's too soon to say if the routine boosters will limit the outbreaks. And I'd use your health alert network if we have one, and usually a public health, the director of public health will tell us when there's something emergent that we have to consider treating ourselves for. If booster shots are recommended during an outbreak, you just give a single dose of MMR to patients who previously had 1 or 2 doses. So a second dose at least 4 weeks later to complete the series if you've never had an MMR shot. That would be rare if you hadn't had a measles, mumps, and rubella shot. Usually you get it in 2 doses. And if you've had 1 or 2 doses, you can get a booster shot. If you've had none, it's mandatory that you get the 2 doses. It's a live vaccine, so there are people that normally would get booster shots that they wouldn't give to with this one because it's a live vaccine. Immunocompromised people that are HIV, that are on chemotherapy, you don't vaccinate household contacts for these patients. You should vaccinate the household contacts, but not the people that are immunocompromised. Also avoid during a pregnancy and advise women not to become pregnant for 4 weeks after the vaccination. The live rubella virus could theoretically lead to birth defects. So remember, there's 3 things in there. There's mumps and rubella and measles. So call your pharmacy or physician if you hear of an outbreak coming on and find out whether they want you to get a live vaccine or not. It's imperative that we do what we can to reduce the amount of outbreaks that we have going through with these diseases that aren't completely taken care of anymore as they used to be several years ago. We are doing a lot more bypass operations now, gastric bypass operations, and which reduces the stomach size and sometimes part of the small intestine. There's the Roux-en-Y gastric bypass, and there is a regular sleeve procedure which just reduces the stomach size. So the medical conditions after surgery, if appropriate, sometimes you reduce or stop the meds for diabetes for some reason. That is cured under most bypass operations, and we certainly wouldn't want to have to take medication that we don't have to take normally because we don't have the disease anymore. There also enteric-coated or extended release meds after the Roux-en-Y. You don't normally have to take those because it's absorbed erratically, not just immediately. And certainly be on birth control pills if you're a female for 3 to 6 months after getting through with your bypass. I have an extra grandchild because my daughter-in-law didn't do that, and now I have to say goodbye. It's Northlake Medical Pharmacy with 2 locations for you at 5136 Hill Road East, across from Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard, give us a call there at 263-1328. Thanks, Paul.
Thanks, Bill. We'll see everybody back here again next Wednesday for Health Talk right here on AM 1270 and 96.5 FM KXVX Lakeport.